friends, I am Dr. Harshad Joshi. I am a consultant gastroenterologist and IBD specialist. I have been practicing in Mumbai for the last 7 years and I have got my specialized training from University of Alberta, Canada about inflammatory bowel disease. In this particular video, we shall be talking about what is IBD, what are the types of IBD, what are the common symptoms, how do we diagnose IBD, are there any specific medication that needs to be taken, what are the complications of IBD, and any specific diet which can either prevent or help in getting the IBD under control. We shall be talking in parts, so keep watching my videos for more information about IBD. I'll talk about IBD. What is IBD? So IBD is an chronic inflammation of your gastrointestinal system, to be more precise of small and large intestine, that leads to various complications and side effects. There are two subtypes of IBD which are concerned. One is called ulcerative colitis, which is an inflammation of the large intestine, whereas Crohn's disease is involving more of small and large intestine, but it can affect any part of the intestinal system, right from your gum to your bum. So we will try to understand what is IBD. It is a chronic inflammation. Now it is because your inflammatory system or your immune system is more active. That leads on to activation of certain fighter cells in your body, which unfortunately act against your intestine, causing development of ulcers and its associated complication. What causes IBD? That would be the next question that most my patients ask. And it is thought to occur as a result of some genetic factors, the type of diet that we consume. There are certain microbes in your intestine. So if there is a change in those microbes or the germs, that leads to activation of the inflammatory system. And partly stress is thought to be an integral part which can drive the change in the bacterial flora in the intestine, leading to development of heightened inflammatory activity. What are the common symptoms of IBD, or when is it that you should consult your specialist for getting the diagnosis? So the common symptoms of IBD are: one is diarrhea. That is the commonest symptom both in ulcerative colitis and Crohn's disease. Some patients of Crohn's disease can also have constipation, but that is less common. Second is blood in stool, which is more commonly seen with ulcerative colitis because there is involvement of large intestines. The third common symptom would be abdominal pain. Now, abdominal pain can be a very vague or variable symptom, and any gastrointestinal problem can come with a stomach pain, but your physician or the gastroenterologist would be able to go through your history and decide whether this is associated with IBD or is there something else. Many patients can also experience the side effects or the complications of IBD. Some of them can come with fistulas around the bum area, or some come with abscesses in that area. IBD is commonly associated with anemia or various other malnutrition, or there are certain ingredients from your diet which are not absorbed, and that leads to many nutritional deficiencies, and patients may come with associated symptoms like excessive fatigue or joint pain or bone pains, or feeling lethargic most of the day, or just on walking a little they complain of breathlessness, which can be related to the anemia, which is a common presentation of IBD. So as we know that genetic factors, dietary factors and stress are responsible for development of IBD. So we can take steps to prevent or reduce IBD by taking care of these. So how can we do that? One thing is genes. You can't do much. That is something which is inherited to you. Now I shall talk about the ways of taking precautions to prevent IBD or controlling IBD. As I spoke earlier, genetic factors, dietary factors and stress are most important in are responsible for development of IBD. So in terms of diet, just reducing high fatty meal, reducing highly processed or westernized diet, incorporating more of fruits, vegetables and vegetarian food can result into reduction of cases of IBD. Smoking is thought to be responsible for worsening and various complications. So stopping smoking is very much essential if we have to prevent complications. There is a specific topic which I shall be discussing later as to what is the risk of developing or passing this IBD into your children. That is a different topic which we will cover subsequently. Stress is thought to be another factor responsible for frequent flares or worsening of IBD, and so stress management is very important. There are various psychotherapies, there are various medications which are available by which we can cut down the stress and thereby reduce the complications associated with IBD. Do keep watching my videos for more information about IBD and its types. Thank you.